Hello, everyone watching this recording. I am Tia Smith. I am a clinical nutrition intern with For Wellness, and today I'll be presenting on how self-love, nutrition, and mindset come together to support your heart health. The title of this presentation is Love Yourself, Love Your Heart, a mind-body nutrition approach to heart health. And my hope for today is that you leave this space or after watching this recording, you feel more informed and more connected to your own heart. Before I begin, I want to read this For Wellness disclaimer. The information provided in this presentation is for educational and informational purposes only and is not intended as a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your licensed healthcare provider with any questions you may have regarding a medical condition or health goals. Participation in this presentation does not establish a provider-client relationship with For Wellness or any of its presenters. While we strive to provide accurate and evidence-based information, individual needs may vary, and the content presented may not be appropriate for all individuals. If this presentation includes demonstrations or recommendations, please consult your physician before beginning any new exercise program. By participating, you acknowledge and accept the risks associated with physical activity and agree not to hold For Wellness, its affiliates, or its presenters liable for any injury or adverse outcomes. For Wellness and its team members do not claim to diagnose, treat, or cure any disease. Any dietary, lifestyle, or supplement suggestions discussed are intended to support general wellness and should be used at your own discretion. By attending this webinar or watching this recording, you acknowledge and agree that For Wellness, its affiliates, and presenters are not liable for any actions or decisions you take based on the information provided during this session. February is a month that celebrates quite a few things, and if you didn't know, February is also American Heart Month, and it's a strong reminder that heart disease is the number one cause of death in the US. And just to briefly go over the difference between heart disease and cardiovascular disease. Heart disease are conditions that affect the structure and function of the heart. And then cardiovascular disease, or CVD, is a umbrella term for all diseases affecting the heart and the blood vessels. So when I use those two terms, you understand the difference between the two. So, heart disease is the number one cause of death in the US, and according to the CDC, it's been the constant number one cause of death since 1950. So, since 1950, it's been the number one spot, hasn't budged for the number one cause of death. And then about 1 in 5 deaths is from cardiovascular disease. In 2022, 19.8 million people died from cardiovascular disease, and that was 32% of all global deaths. And then of that, 85% of that was due to heart attack and stroke. And then in 2021, 38% of 18 million premature deaths were caused by cardiovascular diseases. And premature deaths is anyone who dies before the age of 70. So one of the strongest bit of information from this page here is that 80% of cardiovascular disease deaths are preventable. That means our daily choices including how we nourish ourselves, how we manage stress, how we move, how we care for ourselves, all of that really truly matters. And so today I'm going to talk about how you can care for yourself. Cardiovascular diseases. So, when we talk about cardiovascular disease, we're talking about a whole family of conditions. Some of these conditions include coronary heart disease, and this is a disease of the blood vessels supplying the heart muscle. Cerebral vascular disease is a disease of the blood vessels supplying the brain. Peripheral arterial disease, a disease of blood vessels supplying the arms and legs. Rheumatic heart disease, damage to the heart muscle and heart valves from rheumatic fever. Congenital heart disease, birth defects that affect normal development and functioning of the heart caused by malformations of the heart structure from birth. Deep vein thrombosis and pulmonary embolism is blood clots in the leg veins, which can dislodge and move to the heart and lungs. And then heart attacks and strokes are usually acute events. Heart attacks are mainly caused by blockage that prevents blood from flowing to the heart or brain, and then strokes can be caused by bleeding from a blood vessel in the brain or from blood clots. And so many of these conditions develop silently over time, which is why prevention and awareness is so important. The more we understand our bodies, the better we can care for them. What is self love? So, self love isn't just a feeling, a fuzzy feeling inside. It's a practice. And it's the daily actions that honor your physical, mental, and emotional well being. It's not just feeling good, but keeping a safe internal state that allows you to be kind to yourself during hard times. So, it's the way you speak to yourself when no one else is around. It's the way you care for your body when you're tired or when you're stressed or when you're just stretched thin. And it's creating an internal environment where you feel safe enough to rest, to grow, to heal. And yes, this has real measurable effects on your heart. And so self love isn't just something emotional, it's actually biological too. How self love impacts the heart. So, this is where the science behind this shows up. So, with lack of self care, when you're constantly stressed or hard on yourself, your cortisol rises, your blood pressure rises, inflammation rises, and your heart feels that. Um, Self criticism activates the same neural pathways as a physical threat would. Self criticism activates the same neural pathways as a physical threat would. Emotional neglect often leads to coping behaviors that don't serve us. And when we don't feel worthy, it's harder to stay motivated for healthy, positive change. But acts of self love, when we practice self love, and I mean like real compassionate, intentional self love, the body actually shifts. So stress hormones drop, blood pressure softens, your inflammation improves, and then healthy habits that we try to do for ourselves feel more doable. Self love isn't just a fluffy inside feeling. It's physiology, it's a heart protective. And I have this quote at the bottom: self love is not indulgence or selfishness, it's a physiological heart protective behavior, and there's science behind it. A self compassion study. So, I want to share a study that I came across because I think it validates what many of us might actually feel intuitively. So, researchers looked at 191 midlife women that were recruited at the University of Pittsburgh, and the objective of this study was to determine whether higher self-compassion was associated with lower levels of subclinical cardiovascular disease in midlife women. And when I say subclinical, this is early onset cardiovascular disease. Methods that they used validated psychological scales that measured self-compassion. Carotid IMT ultrasound was used to measure the subclinical cardiovascular disease. And so in their findings, they found women with higher self-compassion had a lower carotid IMT, meaning less early cardiovascular disease. And this suggests that positive psychological factors actually influence cardiovascular health. So think about that. The way that you treat yourself on the inside shows up. It can show up in your arteries, it can show up in your health. Your biology responds to your kindness. That's pretty cool. Know your numbers. So knowing your numbers is an act of self-love. These markers, they give us insight into what's happening um, internally, and they help us create a personalized plan that supports long-term heart health. Okay, so high sensitivity C-reactive protein is a inflammation marker, and that identifies chronic low-grade inflammation that might contribute to plaque instability. And then we have lipid profiles, so your lipoprotein A, remnant cholesterol, and LDL cholesterol, which is the bad cholesterol. Elevated levels of lipoprotein A and remnant cholesterol are actually strongly correlated with a higher risk of heart attack. Remnant cholesterol is the cholesterol that remains after lipase action, and it's also an independent risk factor. Um, blood pressure, your blood pressure is essential in assessing hypertension related vascular damage, and then waist circumference that measures your obesity, and this is also a significant risk factor for a CVD. And I have here some of the ranges of what some your blood work should look like. Always, of course, discuss your findings with your doctor. Common symptoms of cardiovascular disease, and these would be symptoms of heart attacks and strokes, because oftentimes many cardiovascular diseases are silent until something major happens. Symptoms of a heart attack include pain or discomfort in the center of your chest and or pain or discomfort in the arms, the left shoulder, elbows, jaw, or back. You may have difficulty breathing, shortness of breath, nausea, vomiting, lightheadedness, a cold sweat, and turning pale. Symptoms of a stroke include sudden weakness of face, arm, or leg, most often on one side of the body, numbness in the face, arm, leg, especially on one side of the body. You may experience confusion, difficulty speaking, understanding speech, difficulty seeing, walking, dizziness or loss of balance, severe headache, fainting, or unconsciousness. Knowing these signs can save your life or even someone else's life. What affects heart health? Our heart health is shaped by so many parts of our lives. Um, what we eat, which is diet quality, how we manage stress, how we sleep, how we move, um, how much we drink, whether we smoke, and even the quality of our relationships can affect um, heart health. And if you've been to any of my previous presentations, there are common, a few common areas that I talk about a lot um, regarding our overall health. And that's because each of these play such an important role in our overall health and well-being. And I usually talk about nutrition. I usually talk about exercise. I usually talk about sleep hygiene. And I also talk about stress management because those are some really big areas that often have a lot of um, effect on our overall health. And in one of these, if one of these areas is out of balance or not very healthy, we're going to notice that. So these areas also affect your heart health. But the important thing to remember is that every one of these areas is modifiable, meaning um, you can modify, you can change it, you can improve on it. So small, consistent shifts can create a big change overall. The heart healthy plate. So nutrition is one of the most powerful tools that we have. I like to say food is medicine. um, when you're looking at your food options and choosing what to eat, you want to emphasize whole fiber-rich foods. Soluble fiber lowers LDL cholesterol, and sources of this will be oats, beans, lentils, apples, citrus, chia seeds, flax seeds. Antioxidant rich foods help reduce oxidative stress, and sources of this would be berries, leafy greens, beets, herbs, and some spices. Um, Omega-3 fatty acids reduce inflammation and support heart rhythm. Sources of this would be salmon, sardines, walnuts, flax seeds, chia seeds. And then healthy fats, you want to replace saturated fats with unsaturated fats, and sources of this would be avocado, um, olive oil, nuts, and seeds. So you want to think colorful, whole, fiber-rich foods, and these will be foods that your heart loves as well. Continuing with the heart healthy plate, you want to choose protein, um, because protein helps maintain lean muscle mass. It helps stabilize blood sugar, and then plant proteins help to lower your blood pressure. You want to choose colorful plants. They help stabilize blood sugar and reduce inflammation as well. And they're rich in antioxidants and higher in fiber. And then when it comes to alcohol, excess alcohol increases blood pressure, triglycerides, as well as inflammation. So you want to practice mindful drinking. And if you find that you drink um, too much, you want to develop strategies to help reduce your drinking amount. And then you want to limit excess sodium, ultra processed foods, added sugars as well as trans fats. So um, every plate, every meal that you eat is an opportunity to nourish your heart as well. So you just want to be mindful of some things and try to prioritize some of these when you're choosing your food sources. Self-love as daily practice. So, self-love shows up in these small moments. So, under stress reduction, things that you can do to show self-love: deep breathing, mindfulness, taking time in nature, journaling, gratitude. These practices help regulate the nervous system and protect the heart. They help remind your body that you're safe. Sleep hygiene. Sleep is foundational. I talk about in my previous recordings how important sleep is as well. You want to try to aim for 7 to 9 hours of sleep at night. You want to try to keep a consistent schedule, and you want to try to reduce screens for bed before bed. So this would include your cell phone, this would be TV time, this would be video games, computers, laptops, anything like that. Rest is not a luxury, it's a biological necessity. Our bodies need time to rest and heal and reset, and your heart needs downtime too. Movement for heart and mood. So I say food is medicine, movement is also medicine, and you want to aim for 150 minutes of moderate activity a week, plus strength training 2 to 3 times a week starting out. And then you don't want to underestimate the power of a simple walk, especially after meals. Movement supports blood sugar, it supports your mood, and it supports a healthy heart. Emotional self-love. Emotional self-love looks like setting boundaries for yourself, saying no more often or saying no at all, celebrating your small wins, and then releasing perfectionism because striving to be this uh, perfect human being adds stress to ourselves as well that's not needed. So it's giving yourself permission to be human. And your heart thrives when you treat yourself with compassion and love. Stronger together. When you feel supported, safe, and connected, the brain reduces the activation of the stress response system. And social connection is also a strong predictor of heart health. Supportive relationships help to lower your stress hormones. It helps to improve your heart variability and your HRV. And this is just a measure of how adaptive and resilient the heart is. Low HRV is linked to higher risk of heart disease. Um, Social connection also decreases inflammation and reduces the risk of heart attack and stroke. And we as humans, we're wired for connection, and we truly do heal together. We heal as a community. The heart check-in. So this is just a little mini exercise. and I wanted to have you do to help figure out what your heart needs. So you're just going to close your eyes and you're going to place a hand over your heart. And you're going to breathe in deep and exhale a few times and slow your breathing. And you're going to think about some of the things that I've talked about already in this presentation. And thinking of those things, I want you to ask yourself, what does my heart need more of? Do you need to eat better heart healthy foods? Do you need to get in more daily movement? Do you need to focus on better sleep health? Do you need to build stronger connections with others? Or do you need to work on your own self love and setting boundaries, saying no, putting yourself first? So think about, what does your heart need more of? To bring everything together, I want you to create a self-love and heart plan. So this is just a simple 5-pillar plan that you put together that will help create a personalized heart love plan that supports not just your heart, but your whole self. So categories in this plan would be nourish. You are going to choose to eat fiber-rich, colorful, heart healthy foods. Move. This would be daily movement that feels joyful. So you don't want to choose something that you feel is a chore to do. You want to choose movement that makes you happy and you feel good doing it. Rest. You want to prioritize your nightly sleep and recovery. Connect. You want to build supportive relationships with those around you and in your community. And then reflect. Practice self compassion and emotional care. So you could create a plan that is a daily plan or a weekly plan. An example of this would be for this week, I'm going to try to choose a new fiber rich food that I haven't tried and maybe try to eat that 2 or 3 times a week this week. And then movement. If you haven't gone on a walk in a while, you can say, I'm going to try to walk every day after I eat a meal. And then rest. If you don't go to bed at a consistent bedtime, pick a bedtime this week and choose to go to bed, get yourself in bed, reduce screen time by this time. Connect. If you feel that you have a relationship with someone that's not strong enough, or a relationship that brings you happiness and joy, build on that relationship. What are actions you're going to take that builds this connection? And then reflect. What are some self-love and self-compassion habits that you can do for yourself? Do you need to say no at work more often, or is work too stressful and you're taking on too much? Do you need to say no more? That could be something that's part of your plan. So this is an example of what a weekly or even daily, you can change things up daily, what your plan would look like. Um, and just remember that your heart deserves this level of care. It deserves this much attention. So I encourage you to choose one action from each pillar and create a plan that helps encourage a stronger, healthy heart. Heart healthy meals. Here I have some sample of recipes that can be found on the American Heart Association website. First, we have the cheese and vegetable frittata with a fruit salad. The frittata is protein rich, filled with protein rich eggs and fiber dense veggies. And this helps to lower your cholesterol and blood pressure. Next is a Mediterranean bowl. and usually Mediterranean bowls are packed with foods that help reduce inflammation and lower your LDL cholesterol as well as manage your blood pressure. Then there's the turkey medallions with sweet potato walnut mash. So the turkey is full of protein. The sweet potato is full of antioxidants and vitamins that help lower your LDL cholesterol. And then the walnuts have omega-3 fatty acids. And then for a sweeter side, there's the heart healthy maple spice pecans. They are full of unsaturated fats, fiber, and antioxidants, and they help to lower your LDL cholesterol and your triglyceride levels. And like I said, these were found on the American Heart Association website. There are a lot other recipes that you can find there if you need inspiration on heart healthy meals. And so, to recap over the things that I presented today, here are some things I want you to remember, some key takeaways. The number one cause of death is heart disease, um, and it's largely preventable. The risk factors for that are preventable. Heart disease is a condition under cardiovascular disease. Self-love is a heart protective. And there's science that backs that up. How you treat yourself reflects in your heart health. Nutrition matters. Lifestyle habits compound over time, they add up over time to make a bigger change. And most importantly, you are worthy of care. Your heart is worthy of care. I just want to say thank you so much for watching and choosing to care for your heart today. If you have any questions on anything that I presented, or if you like to connect, you can reach out to Dr. Joe and the Ford Wellness team via email at hello@fordwellness.com, or you can call at the number below, and you can also visit fordwellness.com. Thank you for joining and take care of your heart.